Kia ora e ngā mana ko hui mai nei ki tēnei rorohiko ki te kōrero i ngā whakaro ka nui te aroha. Welcome along, folks, to the launch of TOP's health policy. I am joined tonight. I'm very proud to say I have finally made it because I'm joined by Jono and Ben. Hey, but it might not be the Jono and Ben that you're thinking about. I'd like to introduce to you folks a GP and one of our board members, Dr. Jono Hoogerbrug.
Kia ora.
So Jono is joining us from Auckland, and from Banks Peninsula, our candidate for that area, who is a man of many talents, previously a musician. He's worked in mental health and now also worked in various children's charities and now works as a social worker. Ben Atkinson. Kia ora, Ben.
Kia ora. Social support worker just around mental health and addiction field. Nice.
Thanks, Ben, for correcting me. And also thanks for dressing better than me. It's actually freezing cold here in Wellington, so I'm in the top hoodie. Springtime is craziness in Wellington. But anyway, enough about me. We're here to talk about our health policy, folks. Apologies for the delay, and we had some technical difficulties tonight, which arise occasionally. Less so since I got a new computer, and we also apologies also for having the wrong Ben up on the preamble for this. We have a couple of Bens amongst our candidates, so there obviously was a bit of confusion there, but it is the one and only Ben Atkinson that we have with us tonight. And Ben, I'm also proud to announce Ben is our mental health spokesperson, so congratulations on the promotion, Ben.
Kia ora. Keen to just do the good work for it.
Nice. And so, guys, let's just begin by setting the scene a little bit. I mean, TOP's focus really is on prevention, and that applies in physical health and in mental health. Of course, the two are hugely interrelated. And really, as a society, we have been investing almost entirely in the ambulance at the bottom of the cliff. So can you talk us through some of the issues you see with the lack of prevention, both in physical health and in mental health?
Cool. Oh man, in mental health, I mean, the way I kind of look at it is I think there's a real good analogy actually. You've got like two villages down a river, and there's the village upstream and the village downstream. And the village downstream seems to have to often catch people that are floating down the stream, and they're not doing so well. So the people downstream are the ones saving those people out of the river. And they do a really good job at that. They're kind of how I view like psychotherapy around kind of mental health support at the moment. But there's so much of pulling all these people that are falling in from upstream, pulling them out of the water, that we don't do enough of really looking at why they're falling in the water in the first place. Are they getting pushed in? Are they tripping in? Are they falling out of their little dinghies when they're going fishing? And really, it's about kind of trying to look at what are those real base core things that are causing a lot of mental distress, family trauma, generational poverty, drug abuse, sexual abuse, all of these kind of triggers that lead to people feeling unwell. So there's this whole kind of movement now towards a community-led and almost like an NGO-led approach to work within hubs and communities to really support people around those core issues instead of waiting until things like psychosis and borderline personality disorder and stuff like that will kind of come up a bit later in life. So really just trying to get into that community-led approach prior to becoming the ambulance at the bottom of the cliff, which we seem to be so good at doing here in New Zealand.
Yeah, and I mean, worth saying that the current government has invested more in mental health, but it has all been that ambulance at the bottom of the cliff, pretty much. It's all been within the health system, rather than as you say, stopping more people falling in the stream in the first place?
Yeah, I mean, you can see like Mana Ake, so that was, I think, was due to the study down here in Canterbury about the trauma with young children post-earthquakes. And Mana Ake was part of a direct response to that. So there has been significant funding in areas like that. But those that's kind of like following after a mass traumatic event, where we need to also look at just those community effects that are happening at a familial level, and how we're really getting into those communities and helping whānaus out, person to person. And NGOs are fantastic at that. Community-led initiatives are really, really beneficial.
And so, Jono, you're a GP in South Auckland. I mean, what sort of issues do you see with coming through your door that are preventable?
Yeah, so I mean, I guess I'd sort of echo a lot of what Ben has been saying in terms of the mental health crisis that is going on in our communities, and it's a real challenge being trying to provide services, treatments, options for patients when a lot of the drivers that are causing this distress are socioeconomic, are the things that are going on in their lives, affording rent, affording food, worrying about bills, those kinds of things that as a GP you have no control over. So at times you can feel quite powerless. I mean, on the flip side, at other times you can be quite inspired by how resilient and amazing people can be. But you definitely feel like you're going in with not enough tools in your tool belt, and so more fundamental change needs to be made. More levers need to be pulled on, and bigger ideas need to be implemented.
Yeah. So I mean, how does all that stuff play out in terms of what you see at the coalface?
Well, I guess it's always very specific to the individual and the individual's family and community, and it's led by them really. I guess we try our best to support and offer resources. For some people, particularly mental health, medications can be helpful. They're not for everyone, and so for us, it's about trying to create a relationship that can be long-lasting. But with that, there is the challenge of being able to afford to get to the doctors. People live really busy lives, and it can be a real tough one to not only find the time, but access the kind of care that you need. And sometimes it's not always the GPs, it's the NGOs, it's the support workers, it's all these other people that do incredible work. And sometimes we can be quite siloed away from those groups. So, it takes a whole community to get around people, and it's important to recognise that.
And how about on the physical health side, Jono? What sort of issues do you see coming through your door there?
Yeah, well, I mean, as we've seen in the latest UNICEF report on child welfare, and particularly what was quite salient was the child obesity rates. And basically being, I think it was second in the OECD, second worst in the OECD, and with our adults as well, about 1 in 3 would be classified as overweight and obese. And the real challenge is that this is it leads to really serious problems. So people dying younger, diabetes, where people are ending up blind or having amputations, increasing risks of stroke, certain types of cancer, mental health challenges too. So that's a really big challenge, and essentially we're not doing enough, or we're not doing much at all really to support people. from my end, again, coming back to what we can offer is advice and support and medication sometimes, and specialists sometimes, but the environment that people are in is what needs to change. And I guess that's why I'm getting behind TOP's policy, because I see it really moving the needle in that area.
Yeah. And I mean, just before we come to the policy solutions on both these sides of things, I mean, I guess the response that a lot of people give, particularly on the obesity side, is that it is up to the individual what they put in their mouths or how much they exercise and all these sorts of things. And I mean, the evidence on that is pretty debatable as adults, but certainly as children, I don't think we can, blame children for being obese. Nor can we really blame their families when we've seen this, massive increase in obesity over over recent times. And I think the thing that people really don't understand is, if you are obese as a child, it really limits it really makes it difficult for you to manage your weight as an adult, because your body becomes programmed actually to crave certain foods and react differently when you eat those foods, and find exercise more difficult. All of these things become programmed in childhood.
And I think a thing that's quite important to recognise too is with these really calorie dense foods that are available, that they really make you feel full. So you actually feel full on these things that are just absolutely not nutritious whatsoever. And so it can seem like a quick fix, a quick cheap fix for people who don't have a lot of time and don't have a lot of money. And so particularly for kids when they're growing up and developing, these kinds of things, as you said, have long-lasting effects, but also affect their development, can cause behavioural issues, a whole raft of things. And it's important to recognise the environment that people are growing up in. That is completely out of the control of the parents. The advertising world that is consuming people on YouTube, on Facebook, all of these kinds of things, directly targeting children. I mean, we used to look at this kind of stuff the way that we look at smoking, and we used to recognize that, hey, we shouldn't be advertising this stuff to kids. We shouldn't be allowing, comic book characters and all that kinds of things on cigarettes, because we know they cause harm. And so, this is just an evolution there where we need to recognize the seriousness of this problem, and we need to pull out some significant changes.
Yeah. So to the people watching, we are going to start taking questions in a moment. So do keep your questions coming in. We are receiving them. We're just going to briefly talk about TOP's proposals, and then we'll start getting into the questions. So very briefly, what we're proposing is a 20% tax on junk food, and reinvesting the $1 billion that would raise into making dental free for the bottom 20% of our population, the bottom poorest 20% of our population. That's basically you can think of that as community service card holders. So it's beneficiaries and the working poor. And secondly, keeping GP visits under $10, and particularly again in those high needs communities, and offering veggie boxes for families. So cutting out the middle people at the supermarkets and just having at cost veggie boxes available in all of our communities for people to access cheap, nutritious food. And on the mental health side of things, we are sticking with our 2017 policy of increasing the tax on alcohol and putting that $300 million into the community and into those voluntary and community sector NGO organizations that Ben was talking about before, and we'll get him to describe a little bit more about how that looks, because really the immunization, if you like, to mental health issues is all about belonging and belonging and purpose, which is what community provides. So that's a brief overview. Maybe we'll start with you, Jono, just talking about, the sort of value you think in taking that preventative approach that we're talking about.
Yeah, well, I guess there's basically study after study after study looking at the ways that we should be addressing obesity. And if you look around the world, these kinds of sugar taxes are not new. They're in about 20 or 30 countries already in some shape or form. And they are a really important tool to deliver what our country really needs. And I guess the other part is this dentistry part. So, as a GP, I'd often have patients come in with, dental emergencies, and, the ability for them to access emergency dental care is really, really tough. And the hoops that they have to go through with work and income. Many of them have to line up outside the hospital in Middlemore to get just local anaesthetic put into their mouths. And so this 1 in 5 Kiwis is a huge step forward and will relieve a whole lot of people of unnecessary pain and suffering. On the GP, more affordable GP consults side of things, we already know from the New Zealand Health Survey about 15 to 20% of Kiwis don't access primary care because they can't afford it. And what that ends up meaning is that those people turn up in the ED. They turn up with cancers that are more progressed than they should be. And so having a really accessible primary healthcare system is the foundations of a really strong healthcare system. And it's not only going to save us money in the long term, but basically just makes really good sense. And so that's kind of my take on the dental and the GP side of things.
Thanks, Jono. Yeah, it's always struck me as bizarre that we have the most, the most expensive and intrusive part of our health system to be free, and then the preventative and entry level stuff, which all evidence shows has 4 times the benefit for the investment, is where we charge people. It's kind of a really bizarre historical quirk of our health system. So yeah. Coming along to you, Ben, putting this massive funding boost into the community NGO sector. Talk us through more how you sort of see these kinds of hubs working, because these things exist around the country, right? It's just kind of patchwork.
Yeah, just little pockets here or there of some really good examples of community initiatives doing great work. The thing with mental health is that there's never usually just one primary driver that's causing mental unwellness. Like I mentioned earlier, around kind of traumas or family abuse, sexual abuse, drug abuse, generational poverty, things like that. But also, there's a feeling of disconnect from your tūranga waiwai or cultural disconnection. There's issues that you might have with your physical health. There's all these different things that might be leading you to being unwell. Now, that means that when we're looking at a solution, there isn't a one size fits all for everybody, because everybody's an individual, everybody's different, like Jono was talking about earlier. So the key thing about these kind of hubs and how that works at the moment is that you have, say you've got a tangata whai ora client, and they will have many needs to be met by many different community services or NGOs or just grassroots organizations. One of those might be, say, NGO or just a community group that is working on teaching basic cooking skills with fruit and veggies, maybe like a garden to table type initiative, right? It could run as a social enterprise or a charity, doesn't really matter. And that can help train families with some really good tangible skills to look after their families. Then they might need some support around maybe community spirit, getting involved in a sports team locally. Then they might have PCW to help connect them, which is a partnership community worker, which could connect them with a GP. Or maybe a community support worker, which might help with those cooking skills, might help them to get a driver's license or things like that. Their GP is also really important. They might have a specialist mental health worker as well, who's a case manager that works directly with them. They might have someone like me, who's a housing facilitator, who helps them find long-term sustainable housing. So it's about like getting all of these people easily accessible and minimizing those barriers for entry for those people, as the barriers are the toughest part. There's currently in our system, it's so easy for people to disengage or to slip through the cracks. And each one of these different things is funded in a way that's very specific. The Mental Health and Addiction Inquiry mentioned it, and the SSPA report also from last year also mentioned that funding needs to be a bit more holistic and generalized, so all these different community organizations can work together in a person-centered and a whānau-led community approach. So we're looking at taking money from cannabis and alcohol reform and the taxes there, and then funding these types of things. Ideally, would have multiple ones in each city. It's about really breaking down those barriers so people can easily get involved, and then they can try out different things and see what's really needed for them. Because all those people I mentioned before that could be around a client might just be suitable for client A. Client B is going to need something totally different. So it's just about really thinking outside of the square and getting all of these different community approaches on board to work with the person.
Awesome, thanks, Ben. That's really painting a great picture of how this could look. So we're moving to questions now, and Jono, we've got a few coming in about the affordability of paying for GP visits, and whether this is whether this is enough, whether we're going to be able to have enough money to guarantee that people are will only pay $10 going to the GP. First off, I mean, what I can say is the amount of money we're putting into primary healthcare is about a 50% increase on the amount that's there at the moment. So this would be a substantial increase in funding for GPs, and we would want to see that system reformed to focus on need. But it is fair to say, isn't it, Jono, because GPs are private practices, that, I mean, even pledges like the free visits for under 13s don't always pan out, do they?
No. I mean, it is a really challenging area that I think a lot of people don't always quite understand, because essentially, as you mentioned earlier, primary care being small business owners, they also have bills to pay, rents to pay, wages to pay, all of those kinds of things. And so it is quite a unique entity when we think of how GPs are placed in our society. And this, as you mentioned, a kind of a historical position that they've been put in as being these small business owners that need to make a buck to keep the lights on, but that money comes from the patients as a proportion.
But there is an increasing trend to setting up GP super centres, isn't there? Which sometimes some of them are even run by DHBs with salaried GPs, and more of a range of nurses and nutritionists and that sort of stuff, so that GPs don't have to do everything. They can have a range of people to refer to. And those sorts of super centres are able to sort of scale up and provide a more cost-effective service in the really high needs areas.
Yeah, so there are a number of models that are sort of starting out around the country. There's things like the Health Hub model, where, as you say, it's trying to utilise all of the community care resources available. So utilising nurses, mental health workers, dietitians, rather than having the GP as the focal point. You actually have the patients as the focal points, and they can interact with the individuals that they need to, and don't necessarily always have to go to the GP as the gatekeeper. Another element to that is trying to build the bridges between primary care and the DHBs, because there is a huge gap between accessing specialist services at the right time, in the right way, in the right place. And I certainly see in South Auckland, and when I used to work out in West Auckland, plenty of patients who would wait really long times on waiting lists really struggle to get in to see a specialist because they have to drive an hour and a half across town and miss work. So there is a disconnect there that can be improved by looking at these more patient-focused primary care and secondary care models.
So, I mean, it's not just about throwing more money into the system. It is about actually changing the system at the same time to make it, future-proof it really for the growing role that primary care is going to play in our health system.
Absolutely. I mean, we really just need to have a bit of a introspection and a rethink. What are we really trying to do here? Where are we going with this? What does this look like in 10 or 20 years? Because we have we have an aging GP population who are looking to retire pretty soon.
You don't look that old, Jono.
A few greys, mate. So, we do really need to have a serious look at our healthcare sector. And we did have the Heather Simpson report come out recently, but it was hardly revolutionary when it was thinking about these particular areas. Yeah.
Hey, so Ben, lots of questions for you as well. So I think we'll just kind of keep moving back between Jono and Ben. You guys need to be funnier to live up to that title, but not really a funny topic. So no pressure. Question from Marianne. Ben, what do you feel about resilience education at young ages to help people cope with things, not only then, but also later as adults?
Absolutely. That would be really beneficial. And I think especially so here in Canterbury, we've been through a hell of a lot in the last decade. 2 massive earthquakes, all the aftershocks themselves caused horrible trauma. The Port Hills fires, the mosque shooting, COVID lockdowns, it's been a really rough time for Cantabrians. The benefit of actually teaching children these skills is massive. It's something that my generation never learned. We would just kind of sweep it under the rug, and we've seen that rising numbers in suicides year after year after year, and for the first time in a while we've had a drop. So I think it's the first time in 3 years we've had a drop of around 30 less suicides. And I think last year 654 suicides in New Zealand, and just under 20% of those were 15 to 24-year-olds. So it is often our younger people and our much older people that are really directly affected by that. Giving children, without being overwhelming and negative, but giving them tools to pop in their toolbox to really deal with situations in life would be amazing. I mean, kids deal with bullying as well. They're living in a social media age that none of us really experience. So being able to train younger people who are, usually incredibly adept at picking these skills up, teaching them how to utilize these would be really good.
Nice. And just, I mean, there are some questions in here, Jono, about just to build on what Ben's saying. There are some questions here about the importance of teaching people about health in school. About proper eating and all that sort of stuff. How much do you think that could play a role?
Yeah, look, of course, education at all levels is important, and I think that's a tool that needs to be used. But unfortunately, it's the same one we've been saying we've been using for years, and nothing's changing.
True.
I would be. I don't have any kids in school, but I mean, I'd be pretty sure a lot of them are getting plenty of education around their food. But it's the availability and accessibility of these kinds of things. And on the marketing side, I mean, if all your favorite sports stars are smashing back Powerades, I mean, that's the cool drink that you go for. You don't care what the teacher tells you. That's what you go for, and that's the environment that they're growing up in.
Yeah. Ben, quite a few questions here. I mean, because we are focused on prevention, there are quite a few questions here about there still not being enough support even at the bottom of the cliff. So talking about people who can only get help when they're suicidal, and when they come out the other side they can't get it anymore. That sort of stuff.
Yeah, that long-term issue is huge in our industry. So is something that a lot of places are starting to take into account now, is that when you help somebody, or say if you're because a lot of funding is goal-based. So, say if, I don't want to get into work because of privacy stuff, but say if you're housing a client and your job is to house them, once you've housed them, technically you should just move on to the next client. Other people need assistance, but what that person really needs is wraparounds to help them settle. So like popping them in a house is not going to solve everything for them long term. And it's same for a lot of those people that go through crisis, might go to the local DHB hospital and then be let out and just expected to drop in with their case manager here or there, and their case manager may be their only support. I'd like to think that things are changing, that case managers are really good at reaching out to the people they need to. And I know people that are in my position that are social support workers, we're often reaching out to other people as well to make sure that people aren't falling through the gaps, and that people do actually have genuine long-term support. Because you can have people going into a rangatamariki at a family group conference, and they're all talking the big talk that, we're doing XYZ for this person. But unless they can actually promise to provide that in the long term, then it's not really doing anything for the family. The whānau feels that they're just getting lied to. So that creates a disconnect between services and clients, when really we want the client to be here and the services to be able to wrap around them.
Ben, I know we've had this conversation before offline, but I think it might be useful to have it in front of the public as well, because I mean, as I've told you, I'm part of a peer facilitated men's group that we meet fortnightly, and in an effort to deal with all that stuff you were talking about before, about Kiwi males talking about their feelings more. And I mean we're all privileged enough to have been able to afford to go to a course which taught us how to facilitate each other. But I really do feel like that's a hugely effective instrument going forward, in terms of because I mean, we're not, of course, if someone has really acute issues, then they should seek help. But in terms of maintaining your mental health, I really think these sorts of peer facilitated stuff is really important, but that does require investment as well, doesn't it?
Yeah, definitely. I mean, there's a lot of really good information out there that's available. Often on my personal Facebook page, I'm always sharing things at Merck and all these little wee trainings that you can do that are generally like 1 to 3 hours, and it might be intentional listening or little things that you can do to pick up skills that can mean that you're more capable of being of assistance to your peers, because everyone says talk up if you're feeling unwell. Make sure that you tell someone that you're not feeling good. But you can only tell people to talk up so much. A lot of people don't know how to listen. A lot of people don't know what to do when someone comes to them. It can be quite an awkward and challenging situation. And we need to be able to actually train people in a non-intensive way how to be able to cope in those situations. So there was actually a Australian organization, Are You OK Day, and they've got a good wealth of information there about how you can actually hold space and conversations with people when you're concerned about how they're feeling, and also the Mental Health Foundation here in New Zealand on their website has information about how you can recognize if someone's feeling unwell. But yeah, there's definitely needing some good funding just to make sure that we as a community and as general people can take place in those conversations, because going to a GP is a barrier already, whether it's cost, whether it's intimidation. Some people don't want to go to a GP and talk about how they're feeling. So immediately, because they don't go to the GP, they can't get a referral to specialist mental health services for anything acute that they might have that they really need assistance for. So if you can provide a way that people can learn and have those conversations and encourage their friends to go to a GP, then you're reducing a barrier. So it's just about pulling as many barriers down as we can.
Jono, I mean, some similar comments in the various live streams about, from the health side of things, Top's wanting to focus on prevention, but there's always a need for more investment in treatment, and this is the problem, isn't it? Is that unless you invest in treatment, or even if you invest in treatment, there's unlimited demand for healthcare. So we could continue to pour all of our resources into that ambulance at the bottom of the cliff forever.
Yeah, I mean, it's a huge challenge. I mean, as you're saying, the resource that we have is always finite, and I guess what we're trying to illustrate is the way that it's spent is extremely important, and that we need to really think about what works for people across the country and what works for people locally. And so we have 20 different DHBs, all delivering slightly different services, no coordination or no understanding for what the DHB next door is doing. And so, depending on your letterbox lottery, depends on what you can access, rather than recognizing that there is some standardization that can be done. But at the local level, it's what Ben's saying. It's the community, it's the people around them, it's the people who live there. They are the ones best placed to offer and provide those kinds of services.
So there's quite a few questions in here about how we decide what is a junk food in terms of being taxed. So I'm quite happy to take this one, Jono, unless you
go for it, mate.
Unless you want to. No, okay, cool. Yeah, because I mean, this is a big issue, and I, Top has proposed using the Healthy Star rating system to determine what is junk food, and we acknowledge that system isn't perfect. It needs a solid review. It's there's certainly evolving nutritional science which needs to be incorporated into that Healthy Star rating system. But there's, broadly speaking, when you look overseas, there's kind of two ways that we could do this. The system that was put forward in Mexico for taxing junk food. They just did it on the basis of categories. So they just said, right, confectionery, so sweets, chocolates, chips, soft drinks, all that sort of stuff. We will just say, if you're in this category, you're paying the tax. It doesn't matter if you reformulate those products or anything. When you're in those categories, you're going to be paying the tax. And I have to say, Mexico's approach has been pretty successful. It's a very simple way of defining it. They have a roughly 8% tax, and it has caused a commensurate drop in consumption of those junk foods, particularly amongst lower income groups, which gives real progressive health benefits. You could go that way. The other way you could go is offering a bit more of an incentive. So that this way, what we're suggesting is using a nutrient profiling system. So we have this system in place. It's not perfect, but it is in existence, called the Healthy Star Rating System. So we're suggesting building on that. And that way, even if you are, for example, creating a good which might be in a category which people think of as junk food, if you can reformulate it enough so that it has a better nutrient profile, then the tax wouldn't apply. So it's about giving those food companies incentives to improve the nutrient quality of those goods. Of course, with that sort of system, there will always be quirky border cases that don't quite fit. But the idea really is to and Ben's cat's back again. I always love seeing your cat in a live stream, Ben. No, you should just keep him on screen.
I didn't get a chance to screenshot it.
So yeah, the idea of that, is to give good incentives for people to improve their nutrient profiling. But there will always be quirky cases of things that are left out that you can argue probably should be in, or things that are taxed that perhaps shouldn't be. And that's really why that nutrient profiling system needs a good look. But the idea is that we set the definition of junk food low enough so that everything that is taxed, we all agree, is junk food. And at least we are getting our food system moving in the right direction there. So that's the basics, I guess, of how we came up with that particular approach. And so to all those people who say, well, the Healthy Star Rating System isn't perfect, totally agree. It definitely needs a review, and implementing any system like this would require quite a lot of work to get into the detail. And a few people saying, why don't you make healthy food cheaper? And absolutely, we are planning on doing that. That is one of the things that we want to invest in with the revenue from this junk food tax, and that will be to set up a veggie box scheme effectively in every community around the country, so that farmers can sell directly to people. We cut out the supermarkets, cut out the middle people, and that way people can get nutritious food at wholesale prices effectively. And it's a very it's a very cost-effective way forward. Ben, interesting question here for you next up about trauma, because you were talking about the Christchurch. Should we be thinking about whether New Zealanders are traumatized from the COVID disruption?
Definitely. I think there was figures released today about the increase in drug and alcohol consumption during lockdown.
Oh, is that right?
Yeah, and I can tell you myself, I definitely drank a lot more at home because I wasn't leaving the house, and it was probably just a way to kind of mask how we were all feeling about being stuck at home and dealing with something that was unknown. The fear of the unknown, the ambiguous, is terrifying. I think it would be silly to disregard COVID as a non-event in New Zealand just because it hasn't been as bad as it has been overseas. Mental health-wise, I think we'll see maybe two different things. Pure speculation would be that on one hand, some people actually did well without the stress of going to work every day and those everyday expectations that they were struggling with already, and they may have found a way to do better. And then there's the people that really struggle with the whole trauma of it. Dialing in every day at 1 o'clock to watch the news and this whole sense of dread and what's going to happen to our country. It's heavy. It's heavy on a person. So I think definitely we're going to see a bit of an uptake in people registering with mental health services and community services due to this.
Yeah, thanks. Jono, William is asking if if primary healthcare should include a lot more nutrition. So dietitian services, those sorts of things. And again, things like this are happening around the country, aren't they? In pockets.
Yeah. So those sorts of initiatives come around all the time. We have our local PHOs come and do talks to us and offer services. A big challenge that we have often with them is those services being maintained and those services being accessible to everyone. So you sometimes have certain categories of people that can and can't access things. And it just means that you're putting up barriers, kind of like what Ben was saying, that when you don't remove them for everyone, it just makes it a huge challenge. And so for us in the primary care space, yes, we definitely need more of that for sure.
Nice. And a few questions here, Jono, about the workforce implications of what we are of what we're talking about. I mean, you talked about the aging GP population. Are there any other comments you have on the sort of the workforce implications of what we're talking about?
Well, I guess arguably, if we're doing better preventative care with giving people access to better food, to better mental health services, arguably, we actually will not need to be seeing our GPs and going to our hospitals as much. It's also just around thinking about the models of care. So kind of as I was saying before, it's utilising every resource in the community to support people. But I think workforce is definitely something that needs to be considered. And in the medical field, it's often forgotten about, and because it takes so long to train doctors and it's so expensive. So yep, I'm all for different models of care as long as they work for patients.
Nice. And just coming back to to some of the comments on mental health, Ben, I mean, do you think that there's comments about diet being important here too, and I know you made some comments before about sometimes cooking classes can help people, but I mean, do you think, to what degree do you think diet really plays into the mental health side of things?
Well, once again, everybody's different, but for some people, the whole junk food thing and over consumption of sugar has shown to have quite detrimental effects on people's mental health. I think just having a healthy diet is just one little bit that you can do to, it's one little bit in your toolkit that you can have to just make sure that your overall health and well-being is okay, both physical and mental. For some people, it might not be as necessary as others. But I think if we can provide options for people that don't otherwise access quality, good, fresh foods and know how to use them, then we're not doing our job right, So, when I used to run fill their lunchbox, which we gave lunches to children who went to school without. The main thing there wasn't about just giving them food because they didn't have food. It was putting them on an equal opportunity to learn and to succeed and not to fall behind in class, right? Where we really wanted to take that, but we never had the funding to do it, was to actually have a porter kitchen that we would take around different schools, tee in with other community groups like Garden to Table and stuff that were growing gardens in schools, and actually teach the children how to make really simple, basic, healthy meals, and then provide them a little cardboard box of that food to then take home and show their parents. Because initially we thought, oh, you know, we could just do a class for parents, but that was just putting up another barrier. So yeah, we've got to find ways that we can encourage healthy eating, disincentivize eating junk food so much. And I think if we can do that, we'll actually see a positive net change in people accessing mental health services.
Jono, a question here from, there's a few people commenting that doesn't taxing junk food punish poor people?
So it's a really good question. It's an important question to ask whenever any sort of tax comes along, is to understand what the implications are down the line. And essentially there's pretty good evidence and literature from around the world that basically illustrates that when you are doing these types of things, as long as you are providing progressive services and access to other things like healthcare, dentist care, fruit and vegetables, then those kinds of trade-offs are still worthwhile. And these are still groups that represent, so I was reading a paper a couple of nights ago, a group representing a bunch of the Pacific Islands, basically saying, you know, this is what we need and we understand how this works. And by putting in these healthcare options in a progressive way, i.e. making them more affordable, you're doing a net good.
Yeah. Question from Sean for both of you. This is quite a good one. There's apparently some discussion about whether the WHO should change its definition of health. And one of the proposals is that health should be redefined as the ability to adapt and self-manage. What are your thoughts on that, both of you?
Interesting. Yeah, I mean, self-management often in some of the support work we do is a goal. When you're meeting people in crisis, self-management isn't really something that's top of their mind.
No, it's a long way away, isn't it? Yeah.
Yeah, but I guess in terms of like a long-term work towards, yeah, it's got a nice ring to it.
Yeah, I guess with all these kinds of things, you know, definitions are very, very hard, and different words mean different things to different people. So saying self-determination or can mean one thing to someone, saying, yep, you know, I need to learn how to support myself. And for other people, it can be used in more of a put down and say, well, you know, that person just needs to get on when something really significant could be going on. So I would be pretty careful with that definition, purely in a sense because of it being a bit ambiguous on those sides.
Good answer. Good answer. Ben, any thoughts on mindfulness apps, both for kids and adults?
Yeah, I mean, for me, the way I look at mental health support is often getting as many things in your toolkit as you possibly can. Because, look, not everything's going to work for everybody. I've tried a lot of apps. That kind of engagement isn't a thing for me, but I'm certain it is for a lot of people. So, you know, my advice to people when they ask me about whether they should try it is give it a go. You know, give it a try, but don't beat yourself up if it doesn't work for you, because everyone has their own own pathway out, you know. For some, it's going to be pharmaceuticals. For some, it'll be maybe getting out and getting active, going for nice walks. For some, it'll be healthy eating and going to the gym. Some will be connecting with friends and family or reconnecting with their cultural past. For others, like myself, for me, when I was going through my issues, it was finding my purpose. So everybody's got a different pathway. So we just got to bring everything in and find what works for the individual.
Yeah, I have to say, in terms of my personal meditation journey, Ben, the breakthrough for me came from realizing that you didn't have to levitate 3 feet off the ground when you meditated, and just realizing that you never act.
Ooh, lost audio.
You still there?
There we go.
He'll just keep rambling for hours. So I'll tell you, I gave meditation a bit of a crack. Tried downloading a couple of apps, and I guess I think kind of to what Geoff was saying is that I recognised that it was just about having a routine more so, rather than trying to find some sort of oneness. It was about having 5 minutes, like having a break, because I know myself and many of my friends have this kind of rush to be efficient at everything, to take on every task, to be everything to everybody.
Yeah.
And it can be really tough sometimes. And so, listen to my podcasts at 1.2 times speed, and then I have to go for a run, and then, you've got to eat healthy, and you just end up breaking your day into this efficiency cycle. And you end up just in a rat race. And it's so I found it helpful just to give me a moment. I will be honest though, I have stopped. It's only sort of 6 to 9 months. Are you back, Geoff?
I am back. Apologies. I don't know what happened there, but all of a sudden I could not hear you anymore.
We lost you.
Yeah, bizarre. Anyway, I've switched headphones and I'm back on. Sorry I missed your answer, but we'll carry on. We've got time for only 1 or 2 more questions before we wrap up, and let's see if there's any last. I guess a few comments about the how much a role should parents have in the health of their the physical and mental health of their children versus the government. I mean, I guess that's a perennial debate, isn't it, about how much should be left up to parents versus the state getting involved.
Yeah, look, I think I actually encountered that a lot when this may be a question after I was talking about giving children lunches because they were going to school without. And that was the question I got all the time was, are you building a dependency? Are they just relying on you? So it took actually taking stake of that and building that into how we operated. So we didn't give them lunches every day. There was certain days that they would get it, and we would change those between the schools. But really what I thought about it was, if a kid comes to you and they've got a black eye because they've been socked by one of their parents, you don't just go, oh, wow, tough luck, you've got a shit parent, on you go. You look at it and you go, well, this isn't okay. What are we actually going to do to help in this situation? look, it's not good if the parents are in a situation where they can't provide, whether that's a societal failure or a failure at a smaller whānau level. It didn't really matter. It didn't matter to us then. It was just about seeing that there was a need and actually doing something about it.
Yeah.
So I guess from my angle is just looking at the status quo, and I think it can be really, really hard for us to shake the situation that we're in New Zealand and say, well, you know, it's been working okay for me, and you know, everybody else just needs to sort themselves out. You know, our statistics in these areas are just appalling, and they're not set to change. And if you don't think it's going to affect you, it's going to be affecting someone in your kid's class. It's going to be affecting a family member, a cousin, a workmate. It's about thinking about the kind of New Zealand we all want to live in, a place that we all know that everybody's getting a go and getting an opportunity to thrive. And that's what these things do. And so I'm not settling for the status quo. I'm asking for significant change, and we've got the policies to back it up. So that's where my head is at.
Awesome. And one last question for you both. You know, there's a few comments about addiction in the live stream, and you know, of course, you know, we are backing cannabis legalization at the same time as we're backing cracking down on alcohol and sugar. And I think for some people this is a bit of a confusing position. But I mean, really, the evidence on the drivers of addiction are much deeper than the substance, right?
Look, cannabis is not the gateway drug. Like, straight away, cannabis is not the gateway drug. Again, trauma, family harm, sexual abuse. These are the traumas that lead to addiction. These are the plights on our society that we just continue to let happen. And then in the same breath, try to point to cannabis and go, you're the reason that people are now smoking methamphetamine. That is just not true. So it may seem a little odd that in one hand we're cracking down here and then relaxing over here. But the thing is that we are making criminals. We are treating people terribly over a little bit of cannabis use, which doesn't seem to do much harm. The only harm is really actually if you're smoking it as a teenager, you're more susceptible to get psychosis, drug-induced psychosis as an adult. So I believe that's under 25 maybe. But the thing is that we need to treat drugs as a health issue, not a criminal one. We need to put more funding into addiction support and actually, you know, stop sending people to jail, send them to drug court and genuinely help them. It's not about putting two different fruits up together and saying, oh, well, you kind of got this approach here and this approach there. The whole point is to like look at different things and have different approaches, because that's what we want, is a real solution and a real approach, not a blanket one over everything.
Yeah. Any thoughts on that, Jono?
Yeah, I guess, I mean, what we're talking about is harm reduction. And so what these are looking at doing is finding the right balance, the appropriate balance for people to thrive. And just echoing Ben's point, I mean, locking people up, turning them into criminals is a waste of money, is a waste of time, it's a waste of people. It's just ridiculous. So yeah, it's a no-brainer for me.
Yeah, and in terms of that harm reduction, I mean, the sort of approach that public health experts talk about is that there's kind of a sweet spot of harm reduction. If you've got on one extreme, you've got, you know, criminalization, which causes high harm, and on the other extreme, you've got kind of, you know, let the free market rip, which causes high harm. And in the middle somewhere, that regulated market is the ideal in terms of, harm minimization. And we can all debate exactly where that is for different products. But certainly I think the evidence that model behind that model is very strong. All right, gentlemen. Hey, thank you so much for your time, for your mahi, for your aroha, great to have you on board, Ben, as our mental health spokesperson. So if people have thoughts or questions or queries, they can look you up on Facebook. And
absolutely.
So that's what's your Facebook page title, Ben?
Ben Atkinson, top candidate for Banks Peninsula. And on that note, actually today is World Suicide Prevention Day. It's probably too late now, being almost 9:30. But to those watching it, take stock tomorrow to think of a friend you haven't talked to in a while. Give them a call, send them a message, ask them how they're doing. We need to just connect more with people. We live in a connected world, but we're just moving apart from each other. So yeah, take the time. And we've got Mental Health Awareness Week coming up as well on the 21st of September. So going to be really trying to get out there and help people learn how to connect with others.
Kia ora. Thanks, Ben. And thank you so much, Jono. I mean, you're not a candidate, so you really are here out of the goodness of your own heart. Thanks for thanks for your involvement and for your coal-face perspective. Really appreciate that tonight.
Thanks.
All right, ka kite anō team. Remember, tomorrow night we have a Facebook Live with the other Ben. Shai will be talking to Dr. Ben Peters in this continuing saga of COVID discussions. So there'll be another AMA chance for people to ask questions about this incredible pandemic that we are in. So, ka kite anō.